Good afternoon, everyone. I'm so happy and pleased to see all of your faces. What is this thing called public health you plan to study? Asked my Jamaican parents. You know how that is. I responded, but almost 20 years later, it took 20 years for them to get it. My father is now a self-proclaimed amateur epidemiologist, and my mother is a contact tracer for our small town in New Jersey. This is funny to me because it took COVID for people to finally understand what public health is. And to some extent, to understand the disparities in our country as evidenced by public health. However, public health professionals always understood what these disparities meant in the grand scheme of things. Public health seeks to not only address the individual, but to also address all dimensions of wellness for human beings. Public health seeks to serve our vulnerable populations, and those are inclusive of children, the elderly, persons living with disabilities, as well as returning citizens and others. More importantly, public health strives to prevent disease and prolong the lives of individuals. But at its core, public health is a social justice movement. One who fully understands public health would characterize public health as social problems. Think of it as social problems that can be predicted by the inequality and injustices that are currently in our society. Health disparities come from those broader inequities where we see a disproportionate number of people who are overrepresenting a particular disease. But contrary to popular belief, our adverse health outcomes aren't by our individual behaviors. Instead, the social determinants of health are what really impacts one's health outcomes. Those are the factors where people live, work, and play, their built environment that they're born into, as well as the distribution of wealth and resources in our society. Life expectancy in the United States is contingent upon one's income, education, and race. And that is not unique to just the DC area. This is across the United States that life expectancy is a challenge for people. When you look at this slide, you'll note that there is a 9-year difference in terms of how long an individual lives in the DC, Maryland, and Virginia area. Just based on that address, you can live till 75 or you can live till 81.3. And that's all contingent upon one's location. When we look at the impact of COVID, a number of vulnerable populations were affected. The populations I'd like to focus on today are children, particularly children in under-resourced schools, as well as our suddenly essential employees. Our children were told, as well as the adults, at the beginning of the pandemic to shelter in place, do not return to work. Life as we know it has come to an end. This virus is real. And the school system sent our children home with laptops and iPads, but did not take into consideration what the home may have been like, and did not take into consideration that these children may not have had access to broadband or internet. What we found out very shortly, before the pandemic, we learned that students did not have access to internet, therefore there was a digital divide created in terms of learning. Children who ate at school on a regular basis were even more food insecure because they were not able to get the meals that they needed when they were at home now, sheltering in place. Children with learning disabilities and special needs were unable to get the education that they needed because their parents were ill-equipped to educate them. All of these things further exacerbate our disparities in the United States, and it took COVID for us to see that. As we turn to our essential employees, it's amazing to me how persons that stayed off the radar for a number of years have now become essential. Our bus drivers, our postal workers, our sanitation workers, persons who worked in retail at the Costco and Sam's Club, and all of these places that we use on a daily basis and often overlook those individuals every day are now essential. Black and Latinx populations are the persons who overrepresent our essential employees. In addition, those are the very same people who often succumbed to COVID as a result of their essential services. So here it is, these individuals work tirelessly and effortlessly every day to serve us. They become essential during a pandemic where they've never been seen by us on a daily basis, and they succumb to the virus. Public health professionals knew that this would happen. We understand how disparities work in the United States. We understand the racial perspective of health disparities. And we believe that health is a human right, so this cannot be tolerated. And the goal is for all of us collectively to see what is happening as a result of COVID being here and do something about it. From an individual level perspective as it relates to health, we also learned that essential workers suffered from the most mental health issues, meaning that anxiety and depressive disorders increased exponentially during COVID for our essential workers. We saw more essential workers begin to abuse substances as well as try them for the first time during the pandemic. We also learned that suicidal ideation increased by a percentage that was significant during that time. And this is important because when we think about the manifestations of loss of income, job loss, as well as this idea of isolation, when you can't really isolate properly the way we were ordered to isolate when there are these other factors that are inclusive. As we veer from our essential workers and look at the general population and COVID's effects on the general population, we also learned through a Kaiser Family Foundation study that in 2020, 45% of Americans said that COVID negatively impacted their mental health by increasing their anxiety. People were fearful of this disease. They didn't know who they would give it to and really struggled with what this meant for them in the long haul. Moreover, persons who are Black and Latinx are less likely to access these services because of provider bias, because of the stigma around mental health, as well as the socioeconomic component of trying to procure mental health services. So only 1 in 3 access these services compared to 43% of white people. Second, substance use disorder has been on a rise, and it was steadily inclining. But during the pandemic, we saw a 28% increase in overdose deaths, specifically as it relates to opioids. And in DC alone, we had a 178% increase in overdose deaths. I want you to consider why people use substances to begin with. It's often a coping mechanism around an unaddressed mental health issue. So they go hand in hand, substance use disorder and a mental health condition. Which takes me to the third health issue, that of suicide and suicidal ideation. While suicide decreased at about 3% during the pandemic, it increased for Black males, Alaska Native, American Indian, and Hispanic males. So it's gone up in that particular cohort. And it's something that we need to pay attention to. So as we grapple with our new normal and coming out of COVID, whatever that means to us at this point, I really believe that COVID came to serve a purpose for us. I believe that COVID came to us so that we could finally acknowledge the blatant disparities and structural inequalities in our country. I believe that COVID came to us so that we could fully see how every single part of our lives intersect with public health, right? Whether we want to believe it or not, everything is related to public health. I believe that the 987,000 people that died as a result of COVID was not in vain. There were many of us, some even in this audience, that showed us what empathy looks like, that put their lives on the line to serve others. And at the end of the day, I believe that this empathy was real, and it showed us collectively how we were stronger together. So if we take a step back and reimagine what the world could look like in COVID if resources were equitably distributed. Let's reimagine a world where education was not based on your zip code and it was quality education for everybody. Let's reimagine a world where your tax base didn't dictate your lot in life. Some think it's a ridiculous notion, say it could never happen. I say, why not? What camp do you fall into? I know for a fact that public health is here to stay. It is mainstream. Public health has gone mainstream. It cannot be denied. However, I do believe that we need people like you who will be at the helm for our next public health challenge. You are the generation who will rewrite policies and run for elective office. You are the generation that will discover new technologies through research and development. You are the generation that will dismantle systemic oppression and speak on behalf of those who are not at the table to speak up for themselves. One might ask, how do I know this? And I would respond, because I know you. I do know you. I know most of you here. So with that said, I believe that we're clear that public health is woven into the fabric of our daily existence. We fully understand that a public health crisis can not only cripple our economy, but a public health crisis can also devastate our families financially, physically, and emotionally. My question is, how will you rise to the challenge? How will you reinvent yourselves for this next public health crisis? I know a lot of people here, and I know a lot of our students are willing and able, but I believe that in this period of COVID, we have been fortunate enough to come through on the other end, and it really gives us a second chance to make a first impression. We get a do-over. A lot of people won't. How will you use this time wisely? You all have been equipped and armed with the education, information, and data to inform the masses. And as we live and breathe, the public health revolution will be televised. Thank you.